Thank you.
ನಮ್ಮಲ್ಲಿ ಸ್ಯಾಪ್ಲಿಂಗ್ ಕೊಡ್ತೀವಿ ಅಂತ ಏನಾದರೂ ಮೆನ್ಷನ್ ಆಗಿದೆಯಾ? ಅದನ್ನು ಹೇಳ್ತಾರೆ ಡೈರೆಕ್ಟಾಗಿ ಲಾಸ್ಟಲ್ಲಿ?
ಇಲ್ಲ ಏನು ಹೇಳಿಲ್ಲ.
ಓಕೆ ಮ್ಯಾಮ್.
ಯಾರಿಗೆ?
ನಮ್ಮ ಒಂದು ಸ್ಯಾಪ್ಲಿಂಗೂ ಅವ್ರಿಗೆ ಕೊಡೋದು ಅಂತ ಹೇಳಿದ್ದಾರೆ.
ಎವ್ರಿಥಿಂಗ್ ಇಸ್ ಅವ್ರಿಗೆ ಡ್ಯೂರಿಂಗ್ ದ ಫೆಲಿಸಿಟೇಷನ್. ಐ ಥಿಂಕ್ ಸ್ಯಾಪ್ಲಿಂಗ್ಸ್ ಮೇ ಬಿ ಡ್ಯೂರಿಂಗ್ ದ ವೆಲ್ಕಮ್. ವೆಲ್ಕಮ್ ಇಸ್ ಕಾತ್ಯಾನಿ ಮ್ಯಾಮ್ ವೆಲ್ಕಮ್ ಮಾಡ್ತಾರೆ ಆಗ.
ಓಕೆ ಮ್ಯಾಮ್, ಸರಿ ಮ್ಯಾಮ್.
ಯಾ. Hello, Valli. That the sapling is during the welcome to the guest. They are asking, students are asking. Somebody has to be told. They are asking me, I am not sure. அவங்க வந்த உடனே இங்கே ஃப்ரண்ட்டில் உட்கார வைக்கிறீங்களா வந்தவங்களே கெஸ்ட்ஸே? ஹலோ, ஓகே ஓகே. Annie. And to ask them to be seated here. You can put your bags down and please don't be in that sleeping mode. Some of you, maybe from clinicals you have come, but still. Don't sit like that, it doesn't look nice in front of the guests. So the guests have arrived. We can please rise and welcome them. The students may be please be seated. Yeah. will be there. நீங்கள் அங்கே இருப்பீங்களே. Will be there.
நீங்கள் அந்த ப்ரோக்ராம் எடுத்துட்டீங்கல்ல, உங்கள்கிட்ட இருக்குல்ல, மினிட் டு மினிட் ப்ரோக்ராம், அவ்வளோதான். இதில் இருக்கிற மாதிரியே தானே இது. ஏதாவது சார்து ஏதாவது ப்ரெசன்டேஷன் இருக்கான்னு எனக்கு தெரியலை. ஓகே, சார்து இப்போ ப்ரெசன்டேஷன் இருக்கான்னு தெரியல இல்லையா? இந்த வராங்க. ஃபஸ்ட்டு இருக்கும் நினைக்கிறேன். இப்போ இத்தனை பேர் இருக்காங்க, இன்னொரு 15 சீட்டு இங்கே வரலாமா? இன்னும் 3 பேரை கூப்பிடலாமா? போதுமா? அங்கே பாருங்கள், நல்ல பிரின்ஸிபல் வந்தாலும் இடம் காலியாக இருக்குமா? அங்கே பேக் சைட் சீட்டு பாருங்கள். ஃபஸ்ட்டு டைரெக்டாக அனுப்புனா நல்லா
டைரெக்டாக
laptop, but I think they have a PPT to show me.
ஓ,
Help with that.
இது எப்படி ஆஃப் பண்ணுறது?
ஆஃப் இல்லை, புஷ் பண்ணால் ஓகே, ஆல் டைம் ஆன். rank I will make it at the top. Thank you, ma'am.
Yeah. May be seated, students. Yeah. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಅತ್ಯುತ್ತಮ ಗುಣಮಟ್ಟದ ಶಿಕ್ಷಣದಿಂದ ಉತ್ಕೃಷ್ಟವಾದ ಶುಶ್ರೂಷಾ ಸೇವೆ. Quality nursing care through quality education is the vision statement of College of Nursing, Nimhans. Today, education emphasizes innovation, bridging theory and practice, and safety in learning. In this regard, today marks another milestone in our institution's journey towards excellence in nursing education with the inauguration of Simulation Lab at College of Nursing. Good morning to everyone present here. I am Pamela John, clinical instructor, given the role of MC for today's program. A very warm welcome to all our distinguished guests, especially to mention Professor Dr. K. Reddamma, Professor Dr. Ramachandra, Dr. Nagarajaya sir, and guests from various institutions, all the heads of the departments, faculty, staff, and students. A very warm welcome to all of you. I now request our principal, Dr. B.V. Katyayani, to escort the chief guest and the dignitaries onto the dais. Let us begin the program with the Nimhans anthem, which will be rendered by Miss Janaki and Miss Parvati from 4th year BSc Nursing.
विगाहमानोऽस्ति नभोऽन्तरालं प्रसन्नसत्त्वः सृहणीयचन्द्रः विगाहमानोऽस्ति नभोऽन्तरालं प्रसन्नसत्त्वः सृहणीयचन्द्रः प्रक्षुब्धसंसार महाब्धिमध्ये भ्रमत्यसौ मानसराजहंसः भ्रमत्यसौ मानसराजहंसः भ्रमत्यसौ मानसराजहंसः ईषद्विकासं कृतरक्तशोभं हृत्पङ्कजं सन्निहितं तु तत्र हृत्पङ्कजं सन्निहितं तु तत्र जलस्य गर्भे निहिता समस्ति सयोग च शान्तिः सयोगज संयमलब्धशान्तिः सयोगज संयमलब्धशान्तिः.
Thank you, dear students, for that melodious rendition of our anthem. I now invite our principal, Dr. B.V. Katyayani, to formally welcome the gathering.
Respected dignitaries on the dais, distinguished guests, faculty members, and all the students, ladies and gentlemen. Yellarigu namaskara. Good morning to all of you. It is my great honor and privilege to welcome you all to the inauguration of our simulation laboratory. Today marks a significant milestone in our journey towards strengthening innovation and excellence in nursing education. This achievement has been made possible through the dedication of our team and the visionary support of our beloved director, deans and registrar. The simulation laboratory will serve as a hub for learning, training and collaboration, providing our students with valuable hands-on experience and helping them build clinical competence and confidence. It gives me immense pleasure and pride to warmly welcome our chief guest, Dr. T. Dilip Kumar, President of Indian Nursing Council, a distinguished alumnus from Chitradurga, Karnataka, and elected board member of International Council of Nurses and the first nursing professional from India to serve as a member of the Global Advisory Committee of the World Health Organization, Geneva. Simulation training has always been very close to his heart, and we feel deeply honored that such an iconic personality has inaugurated our simulation laboratory. On behalf of NIMHANS Institute and the College of Nursing, I extend very warm welcome to you, sir. May I request everyone to give a standing ovation for sir. Thank you. It is also a matter of great pride to welcome our respected director, Dr. Pratima Murthy, Senior Professor of Psychiatry, who has dedicated nearly more than 4 decades of service to this prestigious national institute. We are truly honored by your presence, ma'am. Behind every successful initiative lies a dedication and determination. The driving force behind this project is Dr. Prabha S. Chandra, Senior Professor and former Dean of Behavioral Sciences, whose guidance and commitment ensured that this dream become a reality. On behalf of everyone here, I welcome Madam in her absentia. She is very busy in the OPD, so she couldn't come and attend the function. I also extend a warm welcome to our registrar, Sri Harsha A.H. CAS, whose constant guidance and encouragement have been invaluable. I warmly welcome Sir for this program in his absentia. I warmly welcome all the deans, heads of departments and faculty of NIMHANS. My heartfelt welcome also goes to Dr. Reddamma Madam, Dr. Ramachandra Sir, Dr. Nagarajaya Sir, Dr. Sai Lakshmi Gandhi, Chief Nursing Officer, and Dr. Prashanti Natala, Head of the Department of Nursing. I extend a warm welcome to Dr. Pratibha Swami, Associate Professor, College of Nursing, for the valuable support, guidance and encouragement throughout this venture. A special word of appreciation goes to Dr. Valliammal, lecturer, College of Nursing, whose initiative, perseverance, and continuous efforts from the initial concept to bringing the simulation laboratory into existence. I warmly welcome you, Dr. Valli. I also warmly welcome all the principals of various College of Nursing from Bengaluru, faculty members and dear students who have joined today. I also extend a warm welcome to Mr. Reshant from Ladle and Ms. Manasa from Maple Meditech for the valuable support in the installation of the simulation lab. Once again, I welcome all of you, those who are present here and those who have joined on the online for this special occasion. Thank you all for being part of the memorable occasion. Jai Hind, Jai Karnataka.
I extend a hearty welcome to you too, ma'am. Few minutes ago, our esteemed chief guest, the director, dean and registrar inaugurated the simulation laboratory located on the 3rd floor of College of Nursing. Dr. S. Valliammal, lecturer and director for the simulation laboratory, leader and mentor of the team, will be doing a brief presentation about the simulation lab. Over to you, ma'am. Full screen.
Respected dignitaries on the dais, distinguished guests, faculty, staffs, dear students, ladies and gentlemen. It's my privilege to briefly present the journey of establishing the simulation lab at College of Nursing, Nimans, Bangalore. Myself, Dr. S. Valliammal, lecturer, College of Nursing, currently leading the simulation lab. As we all know, simulation is a teaching methodology. It is safe and realistic learning method for practicing clinical skills before real patient care, thereby improving safety and reducing errors in care. And this is also emphasized by the International Nursing Association of Clinical Simulation and Learning. The vision of this laboratory is to promote competency-based nursing education in alignment with the revised Indian Nursing Council curriculum and global best practices. The aim is to strengthen the simulation-based learning through hands-on training, enabling students to develop clinical competence, critical thinking, and confidence before entering into the real clinical setting. And this establishment happened because of inspiration from the INC sponsorship for Master Training Program in Simulation-Based Education at National Reference Simulation Center, SGT University, Gurugram, New Delhi. I have completed in March 2024. And the initiation of this work has started in Jan 2024, where the proposal presentation was submitted to the institute and simultaneously formulated the core committee team to work on the simulation lab initiation. And in March 2024, I have completed the master trainers at the National Reference Center sponsored by INC. And in the month of April 2024, on 6th April, the 31st BOS meeting was held, and I have presented the details of the proposal, and this proposal was revised, and in May 2024, the budget approval and potential vendors were identified, and later in 2025, from Jan first half, the procurement process and the vendor selections were done by physical verification, and then the site verification infrastructure preparation happened in the late 2025, and installation started on August 18th and completed in December 2025. So, and now today we had the inauguration. This shows the strength and support from our institute and the guidance from the Indian Nursing Council's training. And these are the core team members of the lab: Principal Dr. B.V. Katyayani and Madam Dr. Pratibha Swami, Associate Professor, myself Dr. S. Valliammal, Simulation Lab Director and Facilitator, and Dr. Sushila T. She is also trained recently as Master Trainer from SGT University at the National Reference Simulation Center, will be Coordinator and Facilitator, and Dr. Jyoti Meneji is Faculty Training and Outreach Coordinator as well as Facilitator. Dr. Batmavati and Dr. Shamala will be VR Simulation In Charges as well as Facilitators, and Dr. P. Vijayalakshmi is Research and Development In Charge, and Dr. Pamela John, Facilitator for Community Health Nursing, Dr. S. Vijayalakshmi for OBG Nursing Facilitator, and for Medical Surgical Nursing, the Facilitator is Mrs. Jayanti P. And these are the glimpses where we have completed training at SGT University, and I had an opportunity to be part of the Pan Asia Simulationist Training Center at Mahe, Manipal, and I had a hands-on there. And these are this I have conducted after completing the training at SGT University. A 1-week training program at College of Nursing was conducted, hands-on training using standardized patient. And there's the conceptualization of starting a simulation lab with the support of the principal and the institute were initiated. And these are like ongoing process. Every once in 15 days, we are doing a sensitization program among ourselves to give abreast and update regarding the simulation training methodology with the core team members, and involving student skill training through simulations. And our future plan is optimal utilization of the simulation laboratory for skill training, and developing SOPs for simulation-based training, implementation of interprofessional simulation training programs, collaboration with other departments for integrating simulation learning, and conducting periodic faculty development programs in simulation-based education, like through national, international workshops and conferences, and strengthening research and innovations in simulation-based education to gradually expand the high-fidelity simulation training. And my sincere gratitude goes to our President, Indian Nursing Council, our Director, Nimans, Registrar, Deans, MS, Aramo, Principal, College of Nursing, Simulation Laboratory core team members, faculty, staff and students, vendors, Mr. Reshant from Ladal and Manasa from Maple Meditech, and all our well-wishers and experts who was with us throughout the journey of establishing this lab. And sir, under your guidance and our institute support, we would like to play an important role in preparing the nurses with confidence and competence for the nation and also global wide. Thank you.
Thank you, Dr. Valliammal, for the efforts and your presentation. Indeed, this has been a dream come true for the College of Nursing Nimhans. The chief guest for today, Dr. Dilip Kumar Timappaji, President, Indian Nursing Council, has held this leadership position for over 2 decades, driving significant reforms in nursing education and regulation in India. Over 45 plus years of nursing profession, including roles like staff nurse, nursing tutor, nursing superintendent, deputy nursing advisor, and nursing advisor to the Government of India. Sir is the elected board member of the International Council of Nurses. He is a member of the Global Advisory Group on Nursing and Midwifery of World Health Organization, just now as principal already mentioned. Let me mention some of the major accomplishments and key initiatives by Sir. He was instrumental in increasing the budget for the development of nursing services from rupees 80 crores in the 10th 5-year plan to rupees 3,200 crores in the 11th 5-year plan. He led the upgradations of School of Nursing to Colleges of Nursing, He initiated the National Consortium for PhD in Nursing and introduced nurse practitioner programs in critical care and midwifery. He is also instrumental in launching the Nurses Registration and Tracking System, which is the Live Register. Also in the establishment of the National Reference Simulation Center in collaboration with JAPIGO and the Ladal and the SGT University in Gurugram, Delhi. As the President of National Regulatory Body, Dr. Dilip Kumar has been responsible for strengthening the quality assurance model in nursing education and signing mutual recognition agreements with international nursing boards such as Singapore. He was bestowed the prestigious Princess Sri Nagalindra Award in 2023 by Princess Mahachakri Sirindon of Thailand. The award was for his unwavering dedication and for exemplary contributions to nursing and midwifery both nationally and globally. He is also a recipient of the 2024 Karnataka Rajyotsava Award for Social Service, becoming the first nursing professional to receive this. We are indeed honored to have you with us today, sir. I request you to please share your thoughts with us.
No PPT. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Good morning. Greetings to all of you from the Indian Nursing Council. First of all, respected Dr. Pratima Murthy ji, Director, NIMANS, distinguished faculty members, Dr. Mrs. Katyayani, Dr. Edamma, Dr. Ramchandra and Dr. Nagarajaya, the senior nursing professional leaders worked in the demands. This is a homecoming for me. I was just explaining to the director madam before coming here how I stayed in this campus for 9 months doing a diploma and non-diploma psychiatric nursing. In our days, the GNM program used to have a 9 months psychiatric nursing for the males and for the 9 months for the training for the females in the midwifery. So it is I have quoted the best practices which the NIMANS is practicing in the national level. A lot of best practices we took in policy making, also in many of the interventions at the Ministry of Health and Family Welfare. I am so happy. First of all, I would like to congratulate the director for taking the initiative for launching this simulation center. It is you all know this, how this concept of simulation came into existence. It has come from the civil aviation. The pilots are trained through the simulators because the pilots are having the passenger safety in the hands of the pilot. So we doctors and nurses, we have a patient safety is one of the important responsibility. When we are manipulating the whole body of the human body, I think we should be first trained with competent and confident. And especially now the patients who are coming to the hospitals, I think those days have gone where a patient is coming fully loaded with the health information, the health knowledge. So already there are some studies, even they don't want to be conducted any training through the students. So therefore, it is all the more justified and where the more opportunity for our nursing students to make many errors to acquire the skills. So this is an opportunity during the simulation. You can do as number of errors so that you can become competent and confident in each procedure. I think now I realized after so many, with all the things, how did we do for this passing the marks of our nursing students with a 50% marks in a practical and 50, okay, theory is okay, 50% practical. We cannot afford to have the 50%. I think we should have at least 95% of the passing marks should be there practical. That means we are in a way allowing the student to make errors and to touch the patient. So I think for this, while I was working in the Ministry of Health, I had a lot of discussions with the policymakers to establish the state-of-the-art simulation center, which I was not successful as a working in the Ministry of Health, but as a national regulator, at least when I visited for signing the mutual recognition assessment MRA with the Singapore Nursing Board, where I took my executive committee members along with the 4 members of parliament, because in ours is the only regulatory body. We have 3 members from the Lok Sabha and 1 from Rajya Sabha. So I think even religiously they attend my monthly meeting in the Indian Nursing Council. They all supported me for this, taking that initiative from the whatever we saw in the Singapore, how the Singapore nursing graduates, how the simulations were trained in those city. That motivated me, and that at least I took long time to put it into practice. And it so happened when we were inaugurating our Indian Nursing Council building. I think many of you people who are old timers, you might have seen how our Indian Nursing Council building was there, not having a proper facility to sit. And many of the inspectors used to come to Indian Nursing Council, they did not have a space to sit. So ultimately we were able to have a state-of-the-art the building. In that inauguration, the Honorable Health Minister Naddaji was the chief guest. So in that welcome speech, I made a statement that the Indian Nursing Council is going to have a National Referral Simulation Center. And I think how many people you are aware, JPAGO, John Hopkins International Affiliated NGO, which is stationed in the Maryland, and their presence is there in the 40 countries. Dr. Leslie is happened to be a nurse who is heading the JPAGO. You can imagine how our financial mobilization resources can be, how she is bargaining with the international funding agencies. It is not easy to run an international NGO. So we are very fortunate to have a nursing person heading the John Hopkins NGO, and I was able to get her support. Indian Nursing will be provided with the technical support by the JPAGO. That's how the ball started rolling, and we had a lot of the National Council for State Board of Nursing Examination from the America. We were able to get the architectural drawing, including the electrical drawings, and we were able to see that which the international evidence which is available as on today, that 50% of the curriculum can be trained for the BSc nurses through the simulation. That is the international evidence which is available. We have used the same protocol for the SGT University. We have come to a conclusion 25% is with the study has given that 25% of the curriculum of the BSc nursing can be taught through the simulation. I think this is a continuous study, and our Indian Nursing Council prescription was each state should have this type of a National Referral Simulation Center, because ultimately, see, the hardware, you can just with money, you can purchase the equipments, and I have seen they will keep it for the inspection purpose. That is not going to be helpful until unless my thought process, and I was telling all the people, you can have any amount of the high fidelity or equipments and mannequins and all, until unless if you are not taught the faculty how to use a simulation as a method of teaching, it is not going to be successful. So therefore, Indian Nursing Council took an initiative of a master training program for the 6 days modular training program, and the Indian Nursing Council is investing the money. This investing, why I am using the word, if you recollect the World Health Organization, the state of the strategic direction for nursing and midwifery 21-25, the resolution passed by the World Health Assembly, which has been circulated to all the countries, the 4 themes which has been reflected in the strategic direction for nursing and midwifery resolution is, the first is the investment. They are telling all the countries there is a need to invest more money in nursing. That is the first theme, with Lord Nigel Crisp, was the secretary of the NHS, who is one of the author of this, who took this initiative to the International Council for Nurses and also to the WHO. That's how in 2020, the World Health Assembly, for the first time, they could declare 2020 as the International Year of the Nurse and Midwife. So in that theme, first is the investment, second is the creation of the nursing position, which is a music to ears to me, for me working in the Ministry of Health as a policy maker. So creation of the nursing position is a big challenging, though we have a SIU norms of the Ministry of Finance, still we are not able to implement those SIU norms. The third is the leadership, because there are evidences which are available that a nurse who is working for the patient, who is working closely with the interprofessionally with various experts. So ultimately the coordinator is for the patient is the nurse. So if she has been trained in leadership skills, the impact and outcomes are going to be more effective. This is an evidence. That's why they are telling the third theme is the leadership. Then the fourth theme is the service delivery, means with continuing education, service conditions, and the renewal of license, all those things which have come in this. So therefore, any investment towards nursing education, that it is coming in consonance with the strategic direction nursing and midwifery of the World Health Organization. Now because the SDG goals, which has to be approved, which has to be reached by 2030, that WHO has taken in the last World Health Assembly, they have extended the time of achieving the SDG strategic direction for nursing and midwifery resolutions by 2030. So they have extended for another 5 years, and now all the countries have been advised to see that how best they can improve, and in that respect, even the Indian Nursing Council and also the Ministry of Health and Family Welfare putting more focus on the investing more money for the nursing. That's how you can see the last budget, not this budget, prior to the 157 opening of the nursing colleges, aligning with the medical colleges. That is a big investment Government of India could do it, and a lot of continuing education program, and Indian Nursing Council itself has taken a lot of burden of investing the money for the continuing education program for nursing. So I think one other important, when the Parliament asked the question, how many the human resources there in the country, including the doctors and nurses, I think we give the information that 45 lakhs have been registered from 1947 to date. These 45 nursing professionals include the nurses who are died, who have been gone abroad, who have been sitting at home. So we are not giving the reliable information to the Parliament for making the nursing manpower planning at the state level. So therefore, the Indian Nursing Council should be able to come out the live register that is called National Register Tracking System, NRTS, which we developed through the NIC software, and we were able to capture the data as on today. 14 lakh nurses data, including the latest photograph, latest email ID, latest whatever their qualification, which are referred by the State Nursing Council, uploaded into the national portal. I think that is one of in the new Nursing and Midwifery Commission, which is because very clearly mentioned, the Indian Nursing Council has to maintain the live register. Now our Honorable Health Minister, after taking in the Chintan Shivir, our presentation, now they have informed all the other regulatory bodies in the Health Ministry. They are also being asked to now work out on the live register. Until unless if you don't have a reliable data, we are not going to have a effective manpower planning. This has helped this data NRTS prepared by the INC. During the COVID period, we were able to get district-wise information. If you put the district Bangalore rural, you will be able to get how many nurses are there in Bangalore rural, along with their names, along with the qualifications. So this type of data you can generate, which is available, which has been now tagged into the Prime Minister's office website. So that has helped many of the IAS officers during the COVID period to locate the nursing manpower. So in this, I think due to the shortage of time, I am not going to go into the depth of many of the initiatives what the Indian Nursing Council, which I am going to share with you afterwards. So once again, I would like to congratulate the College of Nursing of the NIMANS and also the Director of the NIMANS for taking this initiative to launch this the simulation. And as I said, I think at least I am able to ensure that during my time, started with one, and we have a second simulation center in Bagalkot. That Bagalkot is going to be a plus, because now the future is going to be licentiate examinations are likely to come. In that, the assessment has been added in that. So that even in the Bihar, we have recently through Japago, we have inaugurated the faceless assessment program for the nursing. I think the future is going to be more of an assessment to ensure that you have a confident and qualified, the nurses are going to be provided to the, and especially now our nurses are required at the global level, and many of the assessments our nurses have to go to the overseas. So now we are asking many of the countries, why can't we have this assessment in India itself, in these simulation centers? I think we have now, you might be knowing how our robust latest curriculum of the BSc Nursing, the Brunswick University, the developed country of Canada, has come to us for giving the dual degree for the Manipal College of Nursing. We have approved the 30 supernumerary seats for the Brunswick University. The last week, another SRM University of Chennai is also another university we are going to have the dual degree program. That itself speaks the volume and robust of the curriculum which Indian Nursing Council has developed for the BSc Nursing, and we are preparing not only for India, for a global requirement. So once again, I would like to congratulate and thanking the NIMANS for taking this very important initiative, setting up the simulation center to train the competent and confident nurses to the healthcare delivery system in India and abroad. Wish you best of luck. Thank you very much.
Thank you, sir, for advocating for nurses at the national and international level, and also for all the hard work towards the establishment of the National Simulation Reference Center to ensure patient safety. It's a pleasure to call on Professor Dr. Pratima Murthy, Director, NIMHANS, for the presidential address.
Good afternoon, everybody. We just finished 8th March, so let me take this opportunity to wish all the women here a very happy International Women's Day. It's a great delight to see so many of you here. So I'd like to, we also listened to Dr. Dilip Kumar's very powerful address, a lot of the achievements that he has made, a lot of the changes that he has brought about, all very, very encouraging to hear. And I'm glad he's the chief guest today because of his interest in this whole simulation, setting up the simulation laboratories, and of course, in making sure that the training to our nursing students is really world-class, and that we set the model for training in the region. My other colleagues on the dais, senior superannuated faculty of the Department of Nursing, Dr. Reddamar, Dr. Ramchandra, Dr. Nagarajaya, all the faculty of the College of Nursing, my colleagues from other departments. I don't see too many of them here today because it's a working day, and of course all the students, ladies and gentlemen. This is, of course, an important milestone, as was mentioned. I think everybody is very excited about it, and rightly so, because I think having a simulation lab is very exciting. I've been to a couple of medical colleges which have it. It's very, very nice to see because it looks all very poshly done, lots of computers around, lots of mannequins, it's very exciting. But I think the real excitement is when we use it optimally. And I think that's why it's very, very important to make sure that our training protocols are in place, our training programs are in place, the evaluations are in place, because it's truly necessary to make sure that we not only enable students to be able to train on it, but also assess how useful it has been. As nurses, there is a tremendous responsibility in patient care, and therefore, learning the skills of how to manage patients effectively and to avoid any kind of errors in intervention becomes extremely critical, and this can be a very useful way of taking this through. Of course, in Karnataka, we probably one of the colleges which has training not just at the level of the BSc courses. In addition, we have 2 other departments which are looking at the training for DPN, and we've now started the DNN, the MSc in neuro nursing, in addition to the MSc in psychiatric nursing. There are several PhDs in the area. And therefore, I think somewhere along the line to have a integrated view of nursing, both from undergraduate training right up to postgraduate training, is very necessary. Historically, of course, there are milestones which determine the way institutions develop, institutes strengthens, institutes segment, etc. But I think it's very important to go back to the table, to the working table, and actually see how much it has benefited all of us, how much it has, in some ways, limited the growth of the discipline, and see what is the best way forward. In terms of positive developments, one of the things that we have done, understanding that we will never get the optimal number of nurses that we want, and the difficulty in retaining interns, is to have a junior nurse available. Now, how many numbers do we have now? 85 per batch, 85 per batch. But going forward, opportunities for nurses after they have got their bachelor's in nursing, 80 for the institute and 80 for outside, isn't it? The junior nurses, a total of 160 nurses. So there is an opportunity now for about 160 nurses to actually, after they've got their qualification, to work in NIMHANS for a year at a decent stipend. I'm not saying it's a great stipend, but it's a decent stipend. And there I wanted to thank all the principals of the nursing colleges. We had a meeting with them about a month ago, and they all were quite excited about giving their students an opportunity to come and practice, particularly mental health and neuronursing, and gain some experience at our institute. So I'm really looking forward to that project, and I hope that takes off this academic year, and that we get more and more young nurses to get experience in mental health and neuronursing. One of the figures that you mentioned was of concern to me, the fact that of the number of people who ought to be registered as nurses, that we just have about 50% of them in the life tracker. And I think somewhere along the line, it necessitates thinking about what are we doing to retain our nursing our nursing graduates. What should we be doing? What are the kind of opportunities we need to provide at every level so that we can retain them? I too see this kind of attrition happening. When there is a demand from all over the world, and when the opportunities are limited, there is a chance for a lot of very, very well-trained nurses to go abroad. I'm not saying they should not look at their careers. They should certainly look at their career opportunities. But I think it's important when we increase and amplify the nursing training to make sure that we have some methods of improving the retention of our nurses. Coming back to the simulation lab, it's a great place for learning, and I think, of course, it took about a couple of years to actually have it happen, all the experiences that the various faculty have gained, taking it to the Board of Studies. Our former Dean, Dr. Prabha, was very encouraging about it. But I think one of the biggest questions that we ask in any institution is to make sure that whatever we provide is of use to as many people as possible. And in that context, I have two important things that need to be taken note of. One is, perhaps, once we establish the training properly for our own students, the fact that we might open it up to other students of other nursing colleges. Because I think we cannot keep it to ourselves. These are opportunities that we need to provide to others. And the second, of course, is that we had discussed earlier that this would be a centralized facility for all the departments which need some kind of simulation. So outside of, the requirement for the department, the College of Nursing, that we would have other departments also come and use this as a centralized facility, so that at the end of the day, we can say that we have good people train. And the other thing is for continuous professional training. I think it's always very, very important not to believe that we have finished learning the moment we have our graduation. Even as practicing nurses, we need to make sure that there is continuing professional education. So I hope that having some kind of a good cycle of accreditation and re-accreditation and retraining, we are doing that very effectively in NABH. Where we insist that, for example, CPR, basic CPR has to be learned by everybody, not just our healthcare providers, but even our administrative staff have to undergo CPR. Similarly, we are trying to encourage many of our faculty and students, of course, to also have an advanced CPR training. So similarly, simulation training I see as an important need for everyone, so that at the end of it, we have our patients in very, very good and safe hands. One of the biggest assets that we have in NIMHANS are our nurses. I'm no hesitation in saying that perhaps they are our most important asset, because I think the image of any institution is determined by the kind of care patients get. And at the end of the day, that care on a day-to-day basis lies in the hand of our nurses. And I'm sure that's true anywhere in the world. So I'm extremely proud of what we have in our midst. And I hope our training is also, I would like somewhere to see that the College of Nursing of NIMHANS is there on top in some accreditation kind of body. And I hope the kind of things that you're doing at NIMHANS is going to send us in that direction. Because I think that's very, very encouraging for everybody. I must also admit that there's one thing I haven't been able to do, and that is really your, some of the cadre changes. It's still lying with the ministry, and unfortunately AIMS Delhi gets quoted as the precedent, although they've done it wrong. But I just hope that whatever we have kind of done in terms of redesignation of some of the positions actually gets sorted out very soon, so that you also feel at the end of the day that your service, whatever you have done as faculty in the College of Nursing, gets recognized and you get your due share. I think for everyone it's very important to get that due share. In terms of the agencies which have helped to support setting up this lab, again, I want you not to consider this as a business model or a commercial model. I think it's extremely important to understand that this is a public health facility. So whatever you input, however long you handhold this, and however well you develop it, it is going to be a very important contribution to providing good healthcare for the underprivileged particularly. And I'm going to underscore that. And therefore, you must go out of your way to kind of support this facility, to expand this facility, and to make sure finally at the end of the day, this is, this ought to be a model for the country and for the region to come out as a very good simulation lab which trains a lot of young people going forward. So congratulations once again, and all the very best going forward. Thank you very much.
Thank you, ma'am. You will be remembered for your significant contributions towards the development of the institution, especially for the simulation lab, and your efforts to rename the training students as junior nursing officers and upgrading their stipend. I now humbly request the dignitaries on the dais to felicitate our chief guest, Dr. T. Dilip Kumar ji. Thank you to all of you for felicitating our chief guest. ಕೃತಜ್ಞತೆಯು ಸರಳತೆಯನ್ನು ಶಕ್ತಿಯಾಗಿ ಪರಿವರ್ತಿಸುತ್ತದೆ. Gratitude turns simplicity into strength. I request Dr. Pratibha Swami, Associate Professor, College of Nursing, NIMHANS, to propose the vote of thanks.
Good afternoon, everybody. Respected dignitaries on the dais, principals of various institutions, esteemed faculty members, HODs, former HODs of Department of Nursing, distinguished guests, special invitees, office staff, dear students, and other invitees. With deep gratitude and immense joy, I stand before you today on behalf of College of Nursing to sincerely thank each one of you for making this inauguration program a grand success. Thank you all. First and foremost, we are immensely grateful to our chief guest from the Indian Nursing Council, Dr. T. Dilip Kumar, President, for gracing this occasion with his esteemed presence and for delivering a beautiful and a meaningful chief guest address. We would especially like to acknowledge and thank Sir, whose instrumental efforts and unwavering support were vital in establishing this simulation lab. He was persistent in encouraging all educational institutions of the country and was particularly committed to ensuring that faculty members received hands-on training through skill workshops, which is indeed commendable. Thank you very much, sir. We sincerely thank our director, Dr. Pratima Murthy, for presiding over this function and guiding us with her leadership. Madam approved this proposal with careful consideration, emphasizing the purpose and effective utilization of the simulation lab. Her concern for the impactful use of our resources and her support have been truly appreciated. Thank you very much, ma'am. We sincerely thank our former Dean of Behavioral Sciences, Dr. Prabha S. Chandra, who was the key person behind the initiation and efforts to establish a simulation lab. Thank you, ma'am, in her absence. We appreciate the presence of all the deans of basic sciences during the inaugural function, basic sciences, behavioral sciences, and neurosciences of NIMHANS. Thank you all in absentia. We would also like to extend our sincere gratitude to the Registrar, Shri Harsha, for his constant support and leadership. Thank you, sir. We extend our heartfelt gratitude to our esteemed teachers, guides, mentors, and former HODs of the Department of Nursing, Dr. Redama Madam, Dr. Ramchandra sir, and Dr. Nagarajaya sir. Dr. Redama Madam, who laid the solid foundation of the College of Nursing, and Dr. Ramachandra sir, our former principal, who dedicatedly worked to establish a simulation lab for the college during his tenure. It was his dream or aspiration, but which could not be fulfilled at that time, but it remained a constant reminder before his retirement. Sir, we have made it into reality. Madam, sir, your dedication, vision, and relentless efforts have paved the way for this significant achievement today. We proudly carry forward your legacy. Thank you, madam. Thank you, sir. We extend our heartfelt gratitude to our beloved principal, Dr. B.V. Katyayani, for delivering a warm and inspiring welcome address that set a positive tone for the event. She was very particular about getting the simulation lab for the college, which helped make this event a grand success. We also greatly appreciate her insistence on inaugurating this simulation lab in the presence of the President, Indian Nursing Council. Madam, your vision has become a reality and you truly deserve our deepest appreciation. Thank you, ma'am. A special thanks to the Department of Nursing faculty for gracing this occasion during the inauguration. We would like to commend our dedication simulation team led by Dr. S. Valliammal, lecturer, who is a simulation lab director and facilitator whose perseverance, determination and efforts made the establishment of the simulation lab possible. Thanks for the excellent overview of the establishment of our simulation lab. She was confident and well prepared, clearly presenting the justification to have a lab at College of Nursing before the Board of Studies. Her excellent presentation led to the immediate approval from the BOS members under the able leadership of the former Dean Dr. Prabha S. Chandra. The entire team deserves special recognition for their hard work. Congratulations for this outstanding achievement and success. Thank you, Valliammal and team. We extend our sincere gratitude to all the faculty members of the College of Nursing for their dedicated support and encouragement throughout this project. We extend our sincere gratitude to all the faculty members of the College of Nursing for their dedicated support and encouragement throughout this project. Let us collectively commit to utilizing the lab effectively to benefit our students by enhancing their clinical skills and advancing quality of nursing education. Thank you all. We also extend our gratitude to the faculty members from other departments, principals, faculty from neighboring colleges, staff from the clinical nursing services, staff from the Department of Nursing who attended this event, fostering a spirit of collaboration and strengthening professional relationships. Thank you all. A heartfelt thank you to the office staff who have supported us from the initial planning stages to the successful execution of today's event. Ms. Vishalakshi and Mrs. Chandrakala. Our gratitude goes to the technical support team from the BME. I also thank our Swachhata team for the assistance which has been truly essential in making this event a reality. We sincerely appreciate all their efforts. Thank you all. We extend a heartfelt gratitude to Dr. Jagadisha Tirthahalli, Senior Professor, Department of Psychiatry, for graciously permitting us to use this beautiful hall. Without his support, we would have not been able to successfully carry out this program in this large numbers. Thank you, sir. I would like to extend my sincere appreciation to Mr. Reshant and Mrs. Vijay of Lauderdale Medical India Private Limited, as well as Mrs. Manasa of Maple Meditech, along with their respective teams for their instrumental role in developing and establishing the simulation lab from the inception to completion, culminating in the delivery of a fully equipped and operational facility. Thank you. A special thanks to the students whose enthusiasm and participation inspire us always. Actually, dear students, you are fortunate to witness this program in reality, and I sincerely advise you all to make use of the simulation lab effectively for gaining efficient clinical skills. Thank you all. Finally, we are grateful to the Health Education and Publication Department for their exceptional work in covering the program through photography and managing the printing of the invites, ensuring everything was perfect. I thank Ravi and Chetan. Thank you. And in conclusion, I thank all the invitees and those who are gracing this occasion for your presence, support and encouragement. This success is a collective achievement, and we look forward to many more such milestones in our journey. I am sorry if I missed anyone. Once again, thank you all, and I thank the organizers for providing me this opportunity to propose a vote of thanks. Thank you.
Thank you, ma'am. Now we are moving towards the academic program. I request the dignitaries to please take their seats in the first row among the audience. as we continue with the seminar on Advancements in Nursing Practice in India, delivered by our chief guest, Dr. T. Dilip Kumar Ji, President, Indian Nursing Council. I hand over the stage to you, sir.
So now shall we do the PPT, sir?
Next is the
This one also next blank ಮಾಡಬೇಕಂದ್ರೆ blank ಮಾಡಬೇಕಂದ್ರೆ
blank ಪಡ
ನೆಕ್ಸ್ಟ್
ಇದನ್ನ
ಅದೇ ಓಕೆ.
Friends, I thought while I am here, maybe the title may be the advanced nursing practice. I thought let us at least see where India in nursing as on today and what are some of the futuristic, especially with regard to my dream of some of the pet subjects like simulation, nurse practitioner, critical care. Because I hope, with due respect to the medical fraternity, if it is here in this hall, how the word of a nurse practitioner is allergic to the medical fraternity. That's why I am making it with very clearly, with due respect to the medical fraternity, the word how the nurse practitioner word, as even before coming to this meeting, I was just sharing with the director Nimans how myself and Redamma prepared one sheet of a questionnaire and inviting the comments of the corporate intensivist, getting the perception of the nurse practitioner, and then how we took it to the Devi Shetty. And I think these are the things needs to be done in any country by the professional association. Unfortunately, we don't have that type of a strong professional associations. So therefore, though the regulator has to initiate this program, which is not necessarily like in American Nurses Association, ANA, they dictate the policy to the government what should be the nursing agenda. The professional standards, it is in the hands of the professional association. Unfortunately, we have a different, so therefore we have to, so therefore my not necessarily advanced nursing practice, I will be sharing where are we. I think many people in the policy table, when we sit with the people, the question they ask, yes, always nursing has been considered as a cost. Always, no, you people, even there are examples when some of the corporate sector people, when they come to me to increase of the seats, the first question I used to ask, for example, to some of the big corporate hospitals in India, you advertise nursing. Through that, you are making the money. But what are you giving back to the nursing? So when we ask this question, many people have asked, what are you, because they are not able to follow that. They can make the nursing as one of the ambassadors of the hospital, because I consider good nursing care can improve the image of the hospital, can also decrease the image of the hospital. So the nurses are, in my opinion, they are the ambassador of the hospital. So therefore, I think even the director Nimans was mentioning about the retention. I think the word, I think which is one of the things which I, in the 6-pay commission, when we were working in the All India Government Nurses Federation led by the Mrs. Kurana, I think one of the things which you made it very clear with the government, like the WHO principle of how to attract, how to retain, because these are the two very important messages which need to be given for the policy makers. So to attract, I think that's what you have to invest money for getting into the nursing. How to retain, because I think for many people they come to me with the corporate sector. Dilip Kumar ji, daily मेरा hospital में 30-40 resignations आता है. So it's so much turnover is there. How do you manage? They all learned the skills of the OT and many of the different departments. So I am losing those trained people. So for them, my pep talk is how much you are giving the salary. See, definitely you can't retain them because you are not paying the salary. And unfortunately, I think many of the countries like Thailand and all, the private sector pays more salary than the government sector. So whereas in India, we pay, I think the first, I think even in, I think I may be wrong or the Nimans people may be able to correct me, the first month's salary of any nurse of government of India like Nimans is a government of India, I think minimum 1 lakh, the first month's salary, the total salary of a nurse will be the 1 lakh per month, the first month's salary. So definitely it will go on as they complete their more number of years of service. So the government of India itself has taken care of how to invest and how to retain it. This is the principle we used to the pay commission at that time. That's why the basic pay for the nurses was increased. That's why we have only. Whereas the private sector, the highest corporate, very well-known corporate, very toply, I don't want to name those names, but the best corporate hospital in India is not paying more than 25,000. That is the best. The lowest may be 8,000 to 9,000. That is the range you have in India. So how can you? So all sorts of excuses are given. No, your products are not good. All that excuses, but. See, you cannot train a person for the future with all the duties and responsibilities with the latest advancement technology which is coming in. Health science technology exploding with the internet explosion which is coming. The patient is coming to you with fully aware of what are the interventions you are going to provide to you in the hospital. So therefore, our challenge is going to be very, especially for the teachers. That's what the concept in the GFATM project we did it was that the board we use the smart board because one of the problem is when the student comes to the classroom, she is going to test the knowledge of the teacher because those days have gone because everything is available in the mobile. So whatever the procedure we are going to teach, she is fully aware of the procedure, steps, everything. So therefore, it will be a challenge for a teacher to retain the interest of the students for 1 hour. So therefore, you have to change the methodology. How to change the methodology? That's why we introduced that concept in the smart board. Give that slate. I don't know many of the GFATM projects still I was told some of the people are using out of the 45 institutions in India we did that. The slate was given to a backbencher. Always the teaching learning process, the last bencher is not involved in the teaching learning process. So to give the slate to the last bencher, ask that person, student, to write what you know, some title you are given, what you are going to teach. The title the teacher has put it, ask the backbencher to write what you know about it. Definitely the backbencher student while writing, it is coming on the in the board, in the computer. I think anything a student is writing at the backbencher, first of all, that person was not involved in the teaching learning process. Anything she or he is writing, it is appearing in the board. He or she will be more related by मैं कुछ लिख रहा हूँ यहाँ आ रहा है. Immediate response to that student is so much elated. Oh, मैं कुछ लिख रहा हूँ यहाँ आ रहा है. So that is automatically it is retained. Memory in the computer it will retained. So like that you give to all the people. So everybody is happy. अच्छा है हमारा मैडम हमको कुछ लिखने के लिए बोल रहा है. So you are involving the students in the teaching learning process that create an interest among the minds of the students. So you have to day in and day you have to change the methodology. You can't go simply giving a lecture every time. Giving the PPTs are not going to make attractive to retain the students. So therefore, you are able to come out in that experiment that the students more elated and they were involved in the teaching learning process. So therefore, each day, so like that, for 60 students have given some comments, that 60 comments have been retained, it is automatically saving. So next day you come and start discussing on one point on that. So that you are going to, the student come to the classroom with something our madam is going to teach, but you are changing the methodology. So you are creating an interest. Next day, the student will be thinking, oh, madam, aur kya kar sakta hai? So therefore, nowadays students' interest to be retained in 1 hour is for a big challenge to the teaching fraternity now. So therefore, you have to come out with a simulation as a method of teaching. So many methods you have to adopt so that to create an interest. So therefore, when we talk in the policy table, anything we tell the working conditions of the nurses, always the policy maker says nursing is costly. Even if I have to increase 100 rupees for each staff nurse per month, a salary, because the numbers are so large in the nursing community in any hospital. So therefore, there are evidences which are available in the world, that World Bank and many of the people have done a study that our nurses, compared to the physicians, they will be able to come out with some of the best public health clinical packages, like non-physician primary care providers such as nurses and midwives have been shown to be very cost effective. Because if you compare between a doctor and a nurses, with the World Bank has done a study that nurses with the cost effective, they will be able to provide the better quality. Because why I am telling is, many of the people with the policy makers, when you sit in the policy discussion, if you ask anything, they are going to, what I am going to get if I invest money for the nurses, what I am going to get. So you have to be with some sort of, aware of some of the best practices, research evidences to argue with the policymakers. So some studies have shown that appropriately prepared nurses can deliver as much as 80% of the health care and up to 90% of the pediatric care that is currently provided with the primary care physician at equal or a better quality and less cost. This is the evidence which is available. So in one of the studies in USA, cost per episode were 20% less when nurses are provided initial care than when physician did. So these are some of the evidences which are available. So therefore, we have to quote these evidences and we have to generate more data. For example, NIMHANS has considered to be one of the best providing the nursing care. You should be able to come out with your final year students some sort of small studies, how their nurses are making an impact and outcome. Impact and outcome is a very important thing. I think how interpersonal relationship is making an impact and outcome. Because being one of the, I think NIMHANS has always considered the way the nurses interact with the patients compared to the other institution much different. So that may be a induction training, that may be some sort of institutional policies, or some of the continuing education programs. So you might be having. So therefore, you have to have some sort of impact outcome studies in the respective institutions. I think very latest, you all know that how the global evidence 2014 very latest Lancet study, how the Lancet study has given the evidence to all the countries, including India. I think the nurse practitioner midwifery program came out of this evidence, and it's 83% of the maternal and neonatal deaths can be prepared if you prepare international standard ICM, International Confederation Midwife Standards. You should be able to prevent the 83% of the maternal and neonatal deaths. This is a big study, evidence which the Lancet gave in 2014. Though India was experimenting with the nurse practitioner midwives earlier to that also, that gave a fillip to the government of India. Now see that whatever I told you about the 4 themes of the State of the World Nursing Report, zone report, where the first the investment. See here, a very clear example, outcome you can see how the National Rural Health Mission, NHM, a National Health Mission, has made a policy commitment. In this, out of that policy commitment is 84,000 nurse practitioner midwives will be trained. This is a policy commitment. Please raise your hand. How many people have read the midwifery guideline which has been published by the Government of India? Please, anybody can raise the hands? How many people have read the midwifery guideline? See, this is strange. You are all teachers. So, it is a very, very important, in my opinion. I think final year BSc students, all the postgraduate students should be given an assignment, including the faculty, to read line by line. Line by line, I am telling you it is a very important policy outcome which has come out of the Government of India. It's not easy. How much money they are going to spend for this training 84,000 nurse practitioner midwives? Not only that, it has made a commitment that midwifery-led units are going to come up. Where the high case load, where it is available, there they are going to construct the midwifery-led units. Already architectural plan has been completed, and the protocols have been finalized. If you see in a state like Uttar Pradesh, where a Meerut is very closer to the Delhi, I don't know how many people are heard. Many of the pregnant mothers, they are very popularly, they are calling the pink lilies. So they want to go to instead of going to the gynecologist, they would like to go to the pink lilies. Those pink lilies are the nurse practitioner midwives. You can imagine, and even in Wardha, the Wardha also it has become popular. So therefore, why I am stressing this important is where the global, the WHO and the International Council for Nurses stressing for the strategic direction for nursing and midwifery, the resolutions, because people may think it is very simple. No, it is not simple. World Health Assembly, where 198 countries, they meet every year in the Geneva, and coming out with a resolution from the World Health Assembly, it's not easy. Until unless the commitment of all the 198 health ministers, 198 health secretaries, 198 DGs, all these people are sitting, and once it is approved, and which is a big takeaway to the nursing fraternity globally, where the WHO, such a WHO, in that forum, recognizing the role of the nurses and midwives. And I think please remember, they have not done to any other profession except to the nurses. They have not declared any year of the midwife or any year of the doctor or any. They are only declared the World Health Assembly International Year of the Nurse and Midwife 2020. They have declared only for the nurses. That itself speaks volume of the respect and the recognition the World Health Assembly is giving to the nurses and midwives. Unfortunately, we could not celebrate the euphoria because the COVID came in. So because the COVID came in, that globally we could not imagine that euphoria of the International Year of the Nurse and Midwife, but that gave an opportunity for the nurses and midwives. I think globally everybody has recognized how the nurses and midwives delivered their services during the COVID period. Many of the, even in the Nirman Bhavan, I have learned some of the IAS officers happen to be the IAS officers, happen to be the doctors. Doctors are becoming an IAS officers. And they told me, Dilip Kumar, मेरा घर में बहुत मेरे brothers and sisters सब doctors हैं. During my admission in the COVID in the hospital, nobody came to see me except I lived and came out with the support of the nurses. Imagine, it is not though it looks very simple, a doctor becoming an IAS officer, and that person's, I think so many people told me in the Nirman Bhavan, your nurses played a very, very significant role. It cannot be measured in terms of the money, what the roles the nurses and midwives played during the COVID. I think globe has been, but still, the way we performed, still we have not got the support in terms of the money or in terms of the supporting for the nursing. I still feel it is not commensurate what the services, what we did during COVID, but still, I think this is one profession, nothing you will get it freely. I am telling you, with my experience, I can tell you, nothing you will get it very easily from the government or from anywhere. You have to work very hard, because I have seen how difficult to get the budgetary approval from the government. Because I have seen in how the doctor, for example, I can give you a number of examples. When I used to write it as a nursing advisor in the file, we should start nurse practitioner critical care program. N number of files I used to write. That file never used to go to the secretary or to the minister. My at least 20 years of service in Nirman Bhavan, I really failed as a nursing advisor. I am telling you, I am admitting the fact. I could not. I brought the WHO people, because I think I have seen in my experience, we may give a better technical advice by the Indian people. Policymakers always accept the white-skinned people advice. So I have seen a number of situations in the Nirman Bhavan working with the ministry. So therefore, I brought even the WHO and many people to tell our policymakers, India should start the nurse practitioner critical care program. I am totally failed. So I was only, as I mentioned, that I think we were really fed up how to initiate, how to crack this. I think we did some small exercise, and all credit, I think that's why, I have to tell the Devi Shetty ji, I think Redama was we were in the Narayana Rudyalaya for the same discussion. So, sir, you people are very comfortable to work in abroad with the nurse practitioner. You all say that nurse practitioner excellent there. Why don't you, when you come back, why don't you bat for us? I am telling you, they don't even utter the word when they come back. I think you might have been seen, nobody, very big consultant who have come back from abroad, they are not praising the nurse practitioner to start in India. That's what I have to tell literally, I think, sir, why are not people are not batting to us when you come back? So at least, no, Dilip Kumar, you know that I am always fascinated with the nurses. Whenever yes, we have seen in action, if you talk half an hour, at least 5 to 8 minutes, you will talk about nursing. That's why we have seen in all his lectures. So at least he took the initiative. He went to the Nadaji at that time in 2014, I think. So afterwards, I retired from the nursing advisor. I was only a president. So as a regulator, I made the efforts, but at least I was having some sort of liberty of interacting with the policymakers. So that has helped me of initiating. That's how now today I am so happy with the one nurse practitioner critical care, and the Indian Nursing Council has come out with 11 nurse practitioners program. And even being I myself, and I am being a part of the ISPN, I think nurse practitioner psychiatric nursing has also been approved. That's what before coming to the meeting I was telling the madam, you have to start the nurse practitioner psychiatric nursing, being an immense, you should start. So I think really I think I am getting a very good last 1 month back I was in neonatal nurses where I was addressing in the neonatal conference. So I think the Kalavati Saran, the director of the Delhi, she was there in that conference. And when we announced this, the neonatal also, pediatric is also, she said she is going to start. At least the government people, at least I could see the first time that the pediatrician, Dilip Kumar ji, hum shuru karenge. And similarly, one of the pediatric surgeon, was also showed the interest of the starting the pediatric. So we have to make some sort of, that's why I request the NIMHANS people, in whichever the capacity you are there, you have to put up the proposal, be after that, use so many other methods, because in any policy outcomes, one straight solutions will not be there. You have to use so many methods to convince the policymakers for any new outcomes. So therefore, once we have this, because many of the studies there, the nurse, the future is going to be the nurse practitioner in all the specialty. So I at least know I am so happy that the nurse practitioner critical care became so successful, and I don't know how many people heard like the MGM Medical College, Mumbai, where the intensivist. Why I am telling this, out of this my PPTs I am telling you. Recently we had a policy meeting in the Nirman Bhavan on the nurse practitioner program. In that, our additional secretary, medical education, in charge of the nursing, Madam Kotwalji was there. So we invited the intensivist from the MGM Medical College, was on the dais. About 17 intensivists were there in a nursing conference. So, Madam was asking Dilip Kumar ji, in nurses conference में medical specialist कैसे आ गया? You know how allergy, if you talk of a nursing training in front of the medical fraternity, I am telling you, this is my experience, I don't know, you may be having a different experience. Hardly you can get a medical fraternity to a nursing conference. Even if they come, it may be for a minute, it may be 5 minutes or 10 minutes. They don't show much interest, but they think everything they know them. And whole healthcare delivery system is doctor-led. Healthcare delivery system is more productive. That's what their perception. It is not so now. The government is realizing different models. The different models already you are seeing the word team. You don't get in India. I did it. The team approach in developed countries, if any outcome is there, the team comes out to the TV, this team has did it, any outcomes. But that concept you don't find in India, because they will take it, I did it. The doctor-led initiatives. So therefore, in that conference, our additional secretary was so impressed to have 14 intensivists. You know, intensivists are so busy people. You know, it's very difficult because they're all working in the ICUs. Even 1 hour time is a very precious, and they were able to come to, with our invitation, Indian Nursing Council invitation. They were in Delhi, attending recently the conference. Our additional secretary was so impressed about their participation, and they spoke, I think they spoke very highly how these nurse practitioners are making an impact and outcome in their units. They were giving the examples. So I think that type of, we are creating an image in the eyes of the policymakers, then only we will be able to get some sort of, investment will come in. Because ultimately the director, ultimately health secretaries, if they have to put more funds to the nursing, they need to be sensitized. They need to be sensitized with the type of investment what the World Health Assembly is telling, invest. So you don't get much investment. So therefore, the investment, that's why Indian Nursing Council also used this, the principle, charity should begin at home. That's why Indian Nursing Council is spending the money, because if I tell in my lecture, no, have the simulation, how many lectures I can give? You have to show it in practical establishing. Yes, we got it established in the SGT universities. We have put it into practice. Then, if I could have, if we would have silent, not going for the training our faculty, then it could not be successful. So we have to educate my general body members of the Indian Nursing Council. Charity should begin at home. We have to invest money for the faculty training. Indian Nursing Council is spending for each faculty, 2 from each institutions, 40,000 rupees per faculty. We are spending the money for their travel, for their stay, and for everything, even the tuition fee, everything. We are spending 40,000 per faculty, and we have made a commitment, policy commitment, that 2 from each faculty, from each institution. That means we have about 5,000 institutions are there in India. We have made a commitment 2 per. If more than 2, let the management bear the expenditure for the training. So we have made a commitment. That policy commitment should come in. Charity should begin at home. That's why we started. I am very happy to see that. I think that training has motivated many of the faculty when they come back. So remember that what type of the simulation what we established in Delhi. I know that each institution cannot have it. We are fully aware of that. Our prescription is each state should have at least 3 to 4 such institutional, regional. In Karnataka, they should have at least 4. In other states also, they should have 4. In north, south, east, west. So the nursing schools located in these zones, they should go for the training. One of the principal, I think we are in the long range objective is final year students, before going out of the college, those final year BSc nursing students, they should get into this simulation of these high fidelity and all standard simulation center. They should work out what are the competencies to become a good staff nurse. I am telling the word staff nurse. So what are the good competencies are required, so that they should go for a 3 to 4 days of 60 or 40 students to that simulation, like where we have in like Bagalkot, like Delhi. They should list out those competencies. In those 3 to 4 days, each student has to go through that motion of the acquiring the competencies, so that when they go to the market, they are fully prepared. So the market is able to take them in like hotcakes. So that type of, that is the whole principle we have adopted, that these type of like Delhi and Bagalkot type of things, each state should have 3 to 4. And in these 3 to 4, all the schools of nursing final year students, they should go for 3 to 4 days to refresh. We know that in India, you have a best, you have a poor. We have a range of the nursing educational institutions. Therefore, ultimately, if they go through the process of this type of the final the simulation center, so the market will be able to accept them. I think just see we all nursing experts, and even many of the students might be sitting here to know that where are we in nurse population ratio. So this is a big, I think I have taken maybe last year I was in Finland attending the ICN Congress, and that country itself is the best nurse population ratio. They have a 22.3 nurses and midwives for 1,000 population. That is the highest in the world you can have. Even the USA is having a 12.5 nurses and midwives for 1,000 population. UK 9.2, Singapore 6.2, Philippines 4.8. Because Philippines is one of the country where we are competing globally. India and Philippines we are competing at the globally for exporting the nurses at the global level. So therefore, even their country, because I think if you know their policy of the government of the Philippines is they are only training the nurses to send abroad. But our Indian policy is not that. Our Indian policy is to train nurses to work in India. Because the government of Philippines policy itself is about to send the nurses abroad. So the whole syllabus is not the Philippines model. It is the model of the other countries' model they are adopted. Whereas our syllabus is totally different. So therefore the Philippines also, and our, I think in Southeast Asia, always, at least I have seen working in the Southeast Asia, and especially with the WHO, the Thailand is also, in nursing, they are the best people, I can say, in Southeast Asia, because their models, their quality of training, and their some of the policies, where a nurse working in the Ministry of Health, she is having a financial power to provide any international delegates comes in a 5-star hotel, she can provide the lunch or dinner. I mean, that financial power a chief nursing officer of that country is having. That type of the financial powers also has to commensurate with the standard of the nursing. So that is the level of the recognition for the policymaker is there in the Thailand. So therefore, India, again I am telling you, 2.43. Even this number looks maybe better. But somebody may say that the international norm is 3 per 1,000. We are very closer to that. I am telling you, it is not a reliable number, 2.43. It is because we have to quote where I am quoting. Otherwise, it may be something like, if we come to the realistic reliable data, we may be having a 1.2, 1.3. That will be the number, because I am this 2.43. What simple exercise what we have done is population divided by the number of nurses registered from 1947 to date. So that means the people who have died, the people who have gone abroad, all the data is there in the 2.43. So that is not a reliable data. So therefore, that is the reason the Indian Nursing Council is the first regulatory body having an argument with the Ministry of Health to have a live register. I think it took me about 8 years to convince the policymaker to start the NRTS program. I am telling you, people may not be knowing how difficult to the policymaker to convince in the policy table of the Nirman Bhavan. They wanted, because many of the IAS officers have gone abroad in the name of the live register to study the nursing information system in America without taking a nurse along with him. You can imagine the IAS officer is going to the America to study the nursing information system in America without having in his team a nurse. So that is the level of the interest was created when I put up the file. They thought this is one of the very important topic, and definitely they can get good recognition in the CVs and all. They tried their level best. So ultimately it took me 8 years to convince the policymaker, and that too I have to play a very tricky game. Tricky game in the sense, they brought some software, they made me to, I saw that software, the first sentence some of the experts wrote in that statement was, the nurses, it is better for nurses to register in the State Nursing Council. This is the first sentence they put up in their PPT to me when an IAS officer brought some agency to make a presentation in front of me. The first sentence I caught him. Sir, it is not better, sir. It is a statue. Without, it is a word statue. When I use the word statue, that IAS officer got, oh, this fellow is not going to agree, because I used the word, it is essential. You cannot practice as a nurse in India without the registration. That is a statue. It is essential. You cannot practice without the. So, how can you say that better? That means this fellow doesn't know the ABCD of nursing. Oh, he understood. Yes, this is wrong. No, we will correct it and all. He went to some of the state nursing councils, got it all, some sort of study was done, and then again he came and presented to INC. It took me about 3 to 4 years. And in the meantime, we went abroad also. He was able to get that positive things. He thought this is a good subject to get the better name. Then ultimately, what happened? Finally, I have to, because being a IAS officer, I am working under him. Somewhere I have to yield that, okay, now we can, yes sir, if all that has been corrected, now we can do it. So then ultimately, okay, please give the funds to this agency and all. Then I have to put the one very good tactical statement, sir. Yes sir, I will keep it in my general body meeting, sir, for approval. Then after getting the general body meeting, sir, I will come back to you, sir. He realized if you go to the general body meeting, you will not get, you will be able to get because general body is definitely, it is my general body, and also with the 4 MPs are there in our general body. He knows that this fellow will not come back with a positive. Then ultimately he said, you do it. So it took me 8 years. I think so much tension and work with the IAS officers, with the administrative you are working, lot of uphill tasks. Ultimately, Indian Nursing Council is the first regulatory body to have this policy of a live register and coming with the NRTS, Nursing Registration Tracking System. So, this Nursing Registration Tracking System, when we started, I think another, you all know that how the overlapping functions between the Indian Nursing Council and the State Nursing Council. We have a better nurses registrars are there in India. Some of the Indian nurses registrars came out with how the better planning is that how to say no to the Indian Nursing Council. They were able to find out some of the loopholes, like what the loophole is. Like they say, sir, ये हमारा act में ना ये word digital नहीं है, तो इसको amendment करना है, assembly में जाना है. See their intelligence, because in their existing act, who was knowing in 1947 when the act was framed, who was knowing the computers are going to come in India, and who know the word digital was not there in 1947. So now our intelligent nursing professionals were able to tell the policy makers, sir, it's a good idea, sir, but our act is saying there is no digital, sir. The word is not there, sir. So what is required? And she quietly told the policy maker, sir, इसका amendment चाहिए, इसके लिए assembly जाना पड़ेगा. You know, once you have to go to assembly, another 6 or 10 years gone. Even to get one word to get it amended in the assembly, it is not going to be easy. So that's how the overlapping functions between the national and center put some sort of, though we were able to, I think when the one of the our Honorable Health Minister in a Chintan Shivar in Delhi, where the Medical Council of India, the Nursing Council of India, Pharmacy Council of India, Ayush Council of India, that in my working in a 40 years of the Nirman Bhavan experience, the first time I had an opportunity to sit with the other regulators, chairman, other chairmen and all. In that meeting, when the presentation was made by the Indian Nursing Council on NRTS, the health minister was so happy. Re, Indian Nursing Council kar sakta hai, to aap kyun nahi kar sakta hai? Now they have told all other regulators to do this nursing registration, means their live register. See, the problem is for effective any, not only nursing, any health, human resource, manpower planning, if you don't have a reliable data, your planning process is going to be heavy. We will be talking in a heavy. So therefore, to have a reliable data, how developed countries were able to be successful in making the manpower planning, not only for the nurses, for others, they have a live. So therefore, I think this is what appreciated. How many people have seen the SON report, State of the World Nursing Report of 2025? I think Indian Nursing Council is so happy. The best practices has been captured in the SON 2025 report of the World Health, ICN and WHO. In the 71 page, if you go there, they have given the, usually boxes will come in the global reports. To get your best practices, it's not easy, any countries. You have to have a lot of, the strength should be there in the best practices. This NRTS finds a place in the latest 2025 SON report in page 75 in a box. unified in the system. And the first they have given the example of the America. The next para, Indian Nursing Council is maintaining the nursing registration tracking system to have the nurses working in and abroad, to also to solve the duplicate of the nurses in India and abroad. So it has been at least 3 lines been printed in that the global nursing report. I think now the Ministry of Health is also very happy to see the one of the, I know India में ना best practices वो भी नर्सिंग में कहाँ आता है, बहुत मुश्किल है. So with great difficulty, and it has come in the zone report of 2025. Our Indian best practice has been put in the box, and you should, I don't know, you people should, the faculty should see our INC website. I am seeing many of the faculty, they will see this website only for the suitability, not for other things. They should see our website. It is there, this zone report of 2025 is there. In that, you go through each page by page, you will get this best practices printed in that zone report. We feel proud that some of the at least best practice of India has been captured by the global report. So therefore, the message in this is still we have a long way to achieve the nurse population ratio of 3 per 1,000. Whatever this story of this PPT is, still a long way to reach the WHO recommendation of a 3 nurses per 1,000. It is still a long dream. Again, another way, if you go to any countries to assess the health indicators, besides the IMR and MMR, they also ask you what will be the nurse-physician ratio. So that is another indicator to assess the health infrastructure which is available in the respective countries. So if you see that, at least international arm of the WHO says 3 nurses should be there, 1 physician. That is the global recommendations. And again here also I am telling you, we are still long way to reach. India 1.91, again I am telling you, this 1.9 is a data, is not a reliable data. Maybe something like we may be landing into the 0.8. That may be the present nurse physician ratio. So we have more doctors than the nurses. Rather, we should have more nurses than the doctors we should have for any health planning. So this is the reverse we have in India. So this is again another. So why I am giving these very important PPT, Saraj. Where are we? Still a long way. With all the support we have, with all the government of India is giving 3,200 crore during my time for the nursing budget, still a long way. Still we have to work long. I think that's what I always feel with my experience I am telling you. I think we are not having a political will. When the health budget is discussed in the parliament, where 2 to 3 hours health budget is discussed in the parliament on the health budget, there is not a single word of a nurse you will find in the health budget. So therefore, the health minister, the health secretary who sits in that behind this thing in the parliament, they are going to observe each word what the member of parliaments are going to speak in that 3-hour budget discussion. They will not hear anything on nurse. So therefore, when they go back to their office, they are so comfortable. Nurses का कोई problem नहीं है. ठीक है, nursing sector ठीक है. So there is no need to make any investment for the nursing sector. That is a simple message goes in. So therefore, that's what I always tell my the professional associations, interest groups who are working for the nurses and midwives. They should make noise. They should make noise, and they should make noise with the right people so that they will be able to reach out to the policy makers. Or sometimes I feel, I think, who is these public representatives like MLAs or MPs? They are all part of the patients. I think they might be coming to the n number of times to see their relatives, or they themselves might be the patients in the hospital. Why they are not speaking on behalf of us when the question comes in the parliament? Or sometimes I think we might have not impressed them. They may not be happy with us. That may be the reason they are not raising the issue in a proper forum. So therefore, it is a big question we ourselves we have to ask, and especially like the All India Government Nurses Federation, the Trained Nurses Association of India, many of the interest groups. Like I think we have to make noise. We have to make noise means at least noise means not in a negative perspective. At least educate them. Educate them how it is not the impact and outcome. Not budgets are not given. Not having a proper nurse-patient ratio. That's why quality is unaffecting. Even our nurse-patient ratio, which I was in the Nirman Bhavan, it is a Ministry of Finance SIU norms, staff inspection unit norm, which Ministry of Finance has approved it. And when we circulated to all the states, I got a reply stating that due to financial constraint, we are not in a position to implement the SIU norms. Simple. So therefore, nobody is making noise. So therefore, I think that is one of the message I want to give is ours in the policy level. I think our nursing issue is not been brought. That is the reason, with all our good work, with all our hard work, and nurses are the backbone of the healthcare industry. And on May 12th, again, I want to give a good news to you people. I think after 3 to 4 years, when in Delhi, we used to celebrate the International Nurses Day on different dates. Some or the other, we were not celebrating the International Nurses Day on May 12th. And this time, fortunately, the President of India has given the time on May 12th at 11:30. She is going to give the national awards for the nursing professionals in the Rashtrapati Bhavan. And again, I am telling you, many of the WHO people have witnessed this our national award function in Rashtrapati Bhavan. Many of the partners like the World Bank and all, I have taken them to that research. They say they are not having these type of award anywhere in the world. I think the big thing what at least India is, at least on May 12th, they may not be giving in terms of the money, they are calling the nurses to the Rashtrapati Bhavan. You know, getting into the Rashtrapati Bhavan itself is some sort of, you feel elated. Because, and that too where the cabinet takes the oath. Government of India's cabinet takes the oath. In that hall, you are being given a national award. So it may be not in terms of the money, the respect and recognition in the nursing sector. In this respect, we have to appreciate the Government of India and to recognizing us on the May 12th. And this year, it's going to be on a May 12th. I think some or the other for the last 3-4 years, somewhere in different dates we used to celebrate. But this time, the Rashtrapati has already given the date on May 12th. I think I am not going to this slide I have spoken much. Again, this is also a slide, we have large number of nursing educational institutions. This is only one sentence I wanted to tell. India is a big country. India is a big country. We have to go with a quantification of expansion. Quality is a concern for us. I am accepting that. Because India is in different states are there in different developmental. So quality is a concern. The priority is different by different governments. So therefore, some of the solutions we are coming out by the Indian Nursing Council, like continuing education, the simulation. These are all the solutions to improve the quality of the nursing education. So therefore, you can't have one prescription to improve the quality. You have to have different the prescriptions. So therefore, we are fully aware. So therefore, I am always putting a question to the people. Oh, if the nursing education in India is not good. So for them, I am going to ask a question. If that is so, why the developed country like Brunswick, Canada, comes to Indian Nursing Council, seeing our latest competency-based curriculum of the BSc, they are straight away they are telling, please permit us, we would like to give a dual degree. it speaks volume of our curriculum. I'm telling you, it may be, you may not be able to realize how important this. Now the Brunswick and many of the foreign universities, they are in the queue to Indian Nursing Council and to have the dual degree. So they have realized our syllabus is in the global standard now. And the Manipal now, they are in third year, those 30 students, they will go only in the internship for 2 months, they will go there in Canada. Once you get a Brunswick University degree, you are already, your gateway is open to the America. Because the America is also uses the same credentials for their, so you are already, one is you are getting a, Brunswick is a different states within the Canada, it's a gateway, again America is a gateway, so that is the level of our syllabus. They are telling they are only giving a 50 hours in a year on some of the cultural perspective of that country, how to address the patient, what are some of the basic courtesies the patients to be provided, cultural perspective, and some of the languages they are going to, that's only they are going to, but clinically they are not adding anything. They are so happy. I think many of the people have come and congratulated the Indian Nursing Council of late, how you are able to prepare this robust curriculum. All credit goes to my Indian Nursing Council experts who worked day in and day out to bring that type of curriculum, so that now we are in the, I think in the globally, many of the countries, they only train for the pediatric nurse, only adult nurse. So they are very, at least our nurses are trained for a comprehensive training is given to even the primary health care is there, psychiatric nursing is there, everything is there. Integrated, a comprehensive curriculum is the Indian nursing curriculum. I think one of the challenges we are facing in this nurse practitioner program, I think positions are not created. I think what is the challenge which we have to now working with the government, and at least I am here and there I am hearing the nurse practitioner qualified people who are getting a job in Narayana and all, they are getting a 75,000 salary who are qualified from the Chennai as a nurse practitioner. That's a good impact. So the impacts are coming in now. They are well paid there and they are recognized. So therefore now I think if you see the list of these in the latest budget, I don't know how many people the Indian Nursing Council was asking you to sit whole day. I don't know how many people, because I could whole day I sat in front of the computer to attend that webinar. I think I have seen in India our faculty is so not in tune with what current trends are happening in India. They are in silos. In Mera college, I am the boss, it's okay. That type of attitude is not going to make an impact and outcome to be a good health professional leaders. I am telling you, I am speaking with sense of responsibility, which n number of examples I have seen. So therefore, yesterday, if you see that, I think many people, even the ministers, were making a statement in that the nurses' word was coming in n number of times. We have to work with the nurses. So the health professionals need to be trained. More nurses are being sought globally. So there our healthcare providers need to be given a good training. All that was even the commerce minister was talking. Even the skill development minister was talking. I think yesterday was a whole day on the health budget webinar was going on, and the message was that I think if I am taking out what that is, they were talking about the 50% of the 767 districts in India going to have a critical care units. The 50% of the districts are going to have a critical care units are going to come up. What human resource? Definitely our critical care nurses are going to get a scope. So similarly, I think the psychiatric, I think when the big push has been given, the upgrading the Tejpur and the CIP Ranchi and opening of the second Nimans in northern part of India is a big push for the psychiatry. You need psychiatric nurses trained, and at least, as I said, if the Nimans start the nurse practitioner program, it will be a beginning to in other centers. And I am telling you, during COVID period, I think Redema knows in some of the presentations they made in ISPN how our psychiatric faculty in Tejpur managed during COVID. I think that psychiatrist told, you please refer to us, we are sitting at the back end. During the whole COVID period, the faculty of the psychiatric people in Tejpur, they managed online every patient. They have not a single referred to the psychiatrist. They were able to manage it. So they are so appreciative, and I am seeing the milieu environment of the psychiatric nursing, what we have in Nimans is there in the Tejpur. And we have that type of a dedicated nursing faculty. I could see there similar status, similar, she is able to get what Redema used to get in Nimans, that type of respect by the director for the nursing faculty they are getting. So therefore, there will be a good future. There will be a good future, because why I am telling you, I am one of the board of director in that Tejpur. When the issue came with along with the health minister, I was sitting. So they were telling the DPN students, they are not getting enough students for the DPN. Then I have to intervene and told the minister, sir, the ceiling, it is only for the northeastern state. That should be extended. Oh, that's a good idea. Let us extend it. At least those states aayega na. If we make it restricted to the only northeastern state, they may not come. So they have they have changed the policy. So therefore, I think now the way we interact, the way we present and where we involve, हमको क्या होना है नर्सिंग का, हमारे लिए क्या है, वो attitude हम faculty and senior people have to remove that concept, because other professions have developed. There is no need to work hard for the medical fraternity. For nursing, you have to work hard to get the recognition. You are not going to get easily the recognition. If you are hard work, because our profession is still yet to be recognized by the policy makers. Therefore, my signature के लिए मैं बैठा हूँ, मेरा काम है, फाइल आएगा, मैं साइन करूँगा. If you have that type of an attitude, nursing will not develop. So therefore, you should have an extra mile you have to work once you are taking the role of a nursing. So therefore, at least now the next thing which is at least Indian Nursing Council thought over is that even nurse practitioner anesthesia, Devi Shetty ji literally telephoned me. Dilip Kumar ji, aap acha kar diya, anesthesia kar diya. I am telling you whether they do it or not. At least I got a telephone call from Devi Shetty, because this is one area where anesthesia is one of the area where a lot of debate is going on whether nurses to be involved or not. But at least the ministry has approved, and at least some of the people are also taking in a positive way. And the first proposal we got it from Punjab for the nurse practitioner anesthesia, and Punjab University, government university has put up the proposal. We have approved it. So I think these type of, even some of the government agencies, they take, I am telling you with all due respect, some of the new initiatives are not coming from Karnataka. I am telling you honestly. So some of the experimental things are not coming up in Karnataka. Though Karnataka is one of the leading in the nursing education, but please excuse me, I am telling in the many of the platform, we are good in teaching unethical practices to other state people. I am telling you with due responsibility, I am telling you, we are good in that, preparing the other nurses who are coming to Karnataka. We have taught the unethical practices to them, and they are going and they are practicing unethical practices. So that type of a leading quality we have taken, and that's a very sad part of thing, we can't help it. I think this is another area. Now the palliative care is also one of the things which in the budget which we are talking more palliative care centers are going to be there. So one of the policy decision Indian Nursing Council has changed is that we have made it a residency format. We know that there are no much takers for the 1 year post basic diploma program. What we are telling is, I think I am telling you many times in many forums, I am telling the people that if any new course like nurse practitioner, management thinks in their mind is, kitna fees milega, kitna admission milega. I am telling them that is not the intention of the Indian Nursing Council. The intention of the Indian Nursing Council is capacity building of their own ICUs. You have n number of in any medical college with the about 100 nurses are working in different ICUs. Those 100 nurses need to be trained first in the critical care rather than getting an outsider to be trained in this ICU. So when I told this concept in MGM, that you Vice Chancellor, yes, this is a good idea. So first in-house capacity building. Then after your at least know in that 50% may go out, your attrition rate will be there. First you have your own good quality because see, you are already paying salary for a staff nurse in ICU. And you enroll her to be a nurse practitioner critical care. While working there in 2 years, she will become a nurse practitioner. One is she is getting a degree. She is getting a degree. If she is very comfortable, she will work there, or she will go somewhere else. But at least your impact and outcome for the patients in that ICU will increase. So when I tell, oh yes, at least whenever I am speaking to the management, they realize that important. Because I think somehow the mindset of the management so is that कोई नया कोर्स शुरू करना है, कितना फीस आएगा, कितना benefit आएगा. No, these are the courses, 1 year and 2 year nurse practitioner courses. The mindset to be there is that my hospital quality, my hospital ICU should be capacity building. That human resource who are there in your ICUs, they can be trained, and many of the doctors are very happy with that. पहले हमारा अच्छा हो जाएगा, हमारा good nurses मिल जाएगा. So therefore I request you people as some of the many senior nurses who are sitting here, you should educate the medical college owners, medical college faculty, and that's how now your own ICUs, your own oncology unit, your own psychiatric unit, you should have with these things. So once you have this, definitely the impact and outcome in the different specialty will increase. And this is a residency format. I think Indian Nursing Council has changed the mindset of training the nurses now. We never had this the residency format like doctor, MD, MS, he is in the residency format. He is 24/7, he is in the ward. That's why they take advantage. Our training is so excellent. So therefore, we have brought that concept now to Indian Nursing Council. No more classroom training. You have to be in a critical care. You have to be in 24/7. In all other specialty, you have to be there. So that is the concept. I think this is again I am telling you. Totally, we have about 42 lakhs. We tell the parliament so many nurses are there, but in this we get about our NRTS, we were able to capture the data of 14 lakh nurses. So still a long way for reaching. Most probably the day NNMC comes, the day NNMC at any time is expected. Once the day NNMC comes, within 6 to 9 months, we will be able to have the 100% capturing the data in NRTS. Because in that new NNMC Act, it is there very clearly, because I am knowingly very well, many people will say, I am not an employee of the Indian Nursing Council, I am an employee of the state, so I will do my own. So all those things are there. But in the NNMC, very clearly one sentence we have got it put up that nothing is instructions given by the Indian Nursing Council, they cannot say no to. So that type of normally, these type of things should not come in the act. But knowing the experience of this, we are able to put these type of statements in the Act. Once the NNMC comes, they have to rely upon that. I think now, yesterday our INC was running the NRTS webinar to all the state nursing councils. I am telling you, state like Jharkhand started the primary registration through NRTS. And we gave a prize in the last meeting, even the Uttarakhand. They are doing much better. The better states are not doing. We consider some of the states are the better administered states, but they are lagging in the behind. So therefore now it's catching it up. Now we are using, at least since I worked in the policy table in the Nirman Bhavan, anything new things we do from Nirman Bhavan. The states are having always, I don't have a human resource, I don't have a space, I don't have an equipment, I don't have a training, normally. So in this NRTS, for them we gave the human resource, INC is paying, we gave the equipments, we gave the computers, and we are everything we are giving. Still, they don't want to because they are under the clutches of the managements. Because once you implement the NRTS, you can't have some duplicacy of the faculty. You cannot have that. That I think they are holding on, but they cannot hold on for any more shortly. This is where I was telling unique nurse identifier system. This is a which has been captured in our zone report. See anything in a box getting in a global report, it is not easy. I think in a global report. In this zone report, in a 7.2 unique nurse identifier system, you see in India, the nurse registration and tracking system was developed by Indian Nursing Council for similar purpose. The first is United States they are quoting. So at least I am so proud that after America, India is coming in. So that we should feel proud of that. And again, they are telling themselves this system is linked with the nurse's Aadhaar information similar to social insurance number, thereby ensuring non-duplication of nurses. This is the where in the non-duplication of nurses can be addressed. The system maintains and live register of a qualified Indian nurses. We have told the nurses working in abroad to log on to Indian Nursing website. You tell where are you. When you come back, you will get the license back. Even to that extent, our software has been prepared. But unfortunately, many people are still not using it. Again, I am telling you how robust our the syllabus or our Indian nursing education. The quality of education of Indian nurses is very high. This is the statement. A lady, the Danish Minister of Higher Education and Science, Christina Egeland, when she was leaving the airport in March 2024, she gave this statement to in the news. The last bite she gave when she came for the bilateral. She said, it's not easy developed countries making these type of statement. So that means they might have gone through the process how the nursing education system is there. That's why she has made the statement of quality of education of Indian nurses is very high. I think I am not going to be telling much about the Brunswick University, and I just wanted to say a few words on the International Council for Nurses. They have given a charter for changes. So they have told all the countries how some of the charter to change the nursing. So the first thing is the protect and invest in the nursing profession. They are telling you have to invest more in the nursing profession. Safe and healthy working conditions need to be provided to the nursing professional. Again, recruit and retain and address workforce shortages. So these are all the changes each country should adopt. This is the prescription of the International Council for Nurses. Finance national nursing workforce plan. Simply you can't have a plan without financing it. So therefore we have to invest money. Invest in nursing education. Full scope of nursing practice. Unfortunately, our nursing is the one sector we have been trained but we are not allowed to practice what we have trained. So that's why they are telling the scope of practice. The scope of practice has been very clearly included in the new Nursing and Midwifery Commission, because at present Indian Nursing Council Act, there is no word of a single of the scope of practice in our act, in the present act. So therefore, we have ensured that in the new NNMC Act, scope of practice, not only scope of practice, the new NNMC Commission can decide what duties and responsibilities, to how much the nurses can prescribe, to how much the nurses can give an investigation to the patients. All that the Nursing and Midwifery Commission will have that. It has been clearly and all the nurse practitioners has been names have been. So no, they can't change it. Even if they have to change it, even if they go to the court, I think they made some of the effort during my time going into some of the court, they could get some sort of a relief. So even if they go to the court, they may not be able to get the relief because it is there in the act. Recognize and value nurses' skills, knowledge and attributes and experience, expertise. Engage, again I am telling you, the ICN is also telling, the WHO is also telling, our National Nursing Association has to be active. I think your standard of nursing education, if you are going to be, mere ko kya hoga, I am getting the salary, if that type of an attitude if is there, the professional will not improve, and many of the times we want to be called as a nursing is a profession. If you want to be called as a nursing is a professional, you have to be up to date with the latest the data, latest the research, and we should do more research, evidence practice, we should do it. They respect human rights and appoint nurse leaders. This is again I am telling you repeatedly, our nursing organization system in India at the state level is very weak. There are no, I think once I told same sentence to Sheila Dikshit madam when we were lamp lighting ceremony in a lady audience. So I was sitting on the dais, madam was sitting next to me. Then I have to tell the Chief Minister of the then Chief Minister of Delhi, madam, Delhi mein there are no maa baap to nurses. She was surprised to hear that sentence. क्या बोल रहे आप? सर कोई भी आपका डायरेक्टरेट में मैं कोई भी प्रपोजल के लिए मैं लेटर भेजता हूँ निर्माण भवन से, कोई अटेंड करने के लिए कोई नहीं है नर्सिंग के लिए. So somebody is there, is a doctor who is so busy with the other things, he will not have a time to address the nursing issues. So there is a need, a person, dedicated nursing person should be there in the directorate. Unfortunately, except West Bengal, we don't have anywhere in India. I think in West Bengal, all the issues of the nursing, including the recruitment rules, including the duties and responsibility, including the selection, including the posting, all the protocols is done by a joint director nursing. There are about 15 nursing people are sitting in the directorate. Their confidential report, their DPCs, due time appointing, all is done by. Health secretary will never see the file until this joint secretary signature. We made the, I think, Prasanna Kumar Hota, the health secretary. We, in the INC website, I have put up, we made the health secretary to write to all the health secretaries. The nursing organization should strengthen from sub-center to the national level. This is the type of a devo letter was sent. But again, I am telling you, we are not getting that much of a backup support from the associations, from the different people. I think that's what I am telling. Nurses have to work hard because compared to the other professionals. So our nursing leaders at the state level is very weak. That's why many things are not happening. I think again these are very important prescriptions the ICN is giving on a policy priorities. See, again, develop, they are telling now all the countries, advanced nursing practice, like nurse practitioner, is a very strongly, now the ICN is telling to the countries. So at least now we have started that. So one of the policy priority to telling the countries, develop advanced practice nursing rules, increase access to high quality health service. There are evidences, if they have a good nurse practitioner, impact and outcome in those specialties are going to be very effective. Then the budget for is going to be reduced because now we are spending a lot of money. address gender-related bias, including the equitable and competitive wages. How the women employees, especially the nursing, is one of the women-centered sector. They are, while deciding the pay package, there is a bias in there. So that's what they are telling the ILO and the other countries, internet. You should tell the countries there should not be a gender disparity should not be there in the deciding the pay. Harness the potential of digital tools. I think now I think digital tools is coming in a big way. I think Indian Nursing Council is also going in a big way. I think the last 2 meetings in the conference in Geo International Center in Mumbai, we are closely partnering with the Digital Health Academy, going in a big conferences we are having. This time in November, we are going to have similar that Mumbai conference in November in Delhi, Bharat Mandapam. This is going to be 2 days, and I am very happy to inform you, I have been made as a co-chair of the conference. So they have made the co-chair, seeing the so much nursing people are involved in the digital tool, and the 6 months training program which IIM, Indian Institute of Management, the IIM Raipur, we have signed an MOU with the Digital Academy and also IIM Raipur. 6 months online training for the nurses. I think it is coming up in a big way. I think about 50 people have already graduated. With that, if they undergo these 6 months, I think many people are becoming more administrators. They are getting a better jobs in the corporate sector. So the digital tool is one of the things which need to be, which we at least INC is focusing. Empower nurses to contribute to the climate agenda. You know how now the global agenda of the climate change. We have to involve ourselves how much in advocacy in the climate change. Provide tailored support for the nursing education and employment and working condition in fragile. I think you know how in war conditions, how our nurses are treated recently in the last week. Many of the nurses, at least ICN, I think in Ukraine, you imagine in a Ukraine war, ICN could go there and conducted a LFC program, Leadership for Change, LFC program, which India is also did that LFC program. Literally when the war is going on, and many of the 40 nurses have undergone this LFC Leadership for Change program. So I think that type of the capacity is being created where our nurses in a difficult war-affected areas. So that is again I think of late, even in the Lebanon, when my board member is also one of the Middle East lady was sending in a WhatsApp how the nurses are being treated during this in the last 2 days. I was getting some of the WhatsApp messages. Very badly, the nurses are being affected in the war zone. So therefore, in the conflict-affected area, taking care of the nurses is also one of the paramount important on the part of the UN agencies. I think renewal of license, I think that's more enough coming in I think I have covered, I am not going to repeat those things. The foreign language is one of the things which now you might have seen our INC regulation that we are allowing them now lot of Japanese language people have started. In Assam we started one of the Japanese language. So more the language programs we have made them to undergo so that they are able to get a better market overseas. I think we have also seen like Symbiosis, the one institution, they have crashed our 25% supernumerary seats. Whatever we have said, I think they have gone to the more that many of the countries now, even in many of the deemed universities, a lot of foreign students are coming. So therefore, we have increased the seats for the foreign students. I think this is at least I am very happy to inform that any organization to be an effective, you need a good infrastructure. So in that, I think some of the people like Kulkarni, you know that one of the very oldest trained nurses association of India president. I have put up what he wrote about after attending this function. How he explained how the INC building was there. Even he has told, whenever we used to go to the INC building, we never used to have a chair and to sit. So that type of, I have put up in the INC website. You see how was that. One of my mindset what I had when I was going through this building, with due respect to the medical fraternity, they think that when many of the medical superintendents of the Sattarjang hospital entered our new building, nursing council का ऐसा building हो सकता है क्या? One of the professor of the All India Institute of Medical Science, he also he was surprised to see our infrastructure. So I am telling you, our nurses still not fully recognized by the other fraternity. So my mindset was, that's why when we were putting about our building, we put a lot of importance. When anybody comes, enters our nursing building, they should change the mindset towards nursing. That is my first objective I kept. That's why many people, they come, when any managements, no management appreciate the regulator. Always they will fight with the regulator. So we have ensured that any management comes, first he is so angry, first he will be served with a cup of coffee, he should become cool before they see the other officials in the... So that type of facility has been created. And my all my about 100 employees working in the Indian Nursing Council, there is no need for them to go to the coffee. The coffee is served at 11:30 on he or his table, and again at 4 p.m. No need to go out, he will be served. So these good practices we have developed, I think that's why it's making a lot of impact and outcome. So therefore, a good infrastructure which we are able to create, this will be a good for the foundation for the future NNMC to work more hard to see that many of the whatever the laid down policies they will be able to implement. I am not going to all that I have spoken. I think BRICS is one of the things. I think BRICS conference is going to be there, and India was not a member of the Asian Nurses Association. Now India has also become now a member of the Alliance of Asian Nurses Association. So now nowhere India has been left out. At least now we are there in the global recognitions, and now the BRICS conference is going to happen in South Africa because of the many of the issues they could not have it. So the BRICS, the India is going to get a better place in the BRICS also. We are also working with the National Skill Development Corporation. I am seeing very good number of nurses are being in Noida being trained, and they are getting good placements outside the country through even yesterday the Skill Development Minister, first in his statement, we are training nurses to send abroad. I was so happy to hear even the non-health ministries are talking about the word of a nurse. I think we are very closely working with the JAPAGO, and I am telling you, one of the center which has been recently opened in Bihar, in Patna, about the assessment. I think faceless assessment system is being worked out. But only thing is, many people have told me that Dilip Kumar is good to have a faceless assessment. Think of what you can do with the empathy. Because the nurses are important to be assessed with the empathy. How the faceless thing you can assess in empathy, I think keep in mind, I think that's a good suggestion we have got, and we are going to work with the JAPAGO how to ensure that. Again, I am telling you, the Doctor of Nursing practice. I am so proud to tell you that the Doctor of Nursing practice with the University of Houston, we were able to start on a pilot basis. I think about 10 students are in MGM have been enrolled, and I think there is a demand is coming. Those 10 people are getting an internship in Houston in oncology division. Means they are coming. Some of the Indian entrepreneur in Houston is going to sponsor. He is so happy to see that because one of the Agarwal who has helped me is an engineer, is not even a doctor, not even a nurse, but he took the interest of the pushing the DNP program in India, and he wants to take our nursing students to give an internship in University of Houston. I think LFC is another program. We are very proud to say that we had the next relicensing we are taking from the ICN to further extend this LFC program. I think this is one program which is making an impact and outcome in the clinical setting. Like for example, one of the staff nurse in Saftarjung, with this program, she was able to, in 3 months of the training program, she was able to take up the issue of infection control. And with this, the tools what we were able to provide, with those tools, he was able to make an impact and reduce the infection control in our ward. So therefore, the issues which are going to make in the leadership for change is going to make an impact in the clinical setting, the leadership change. I think you all know that now the theme for the 2026, the International Nurses Day, is the Empowered Nurses Saves Lives. So this is our president, who has happened to be from Spain. I think he spoke when he took the charge of the ICN president. The mantra was empowered, how to empower our nurses. That's how this year theme is Empowered Nurses Save Lives. In this, only one, the power of trust, the number is so large in the nursing profession that's making, and the power of practice, power of proximity, how closely we are working with the patients, and the power of professionalism, what we have nurses and midwives, and power of care. When now we are talking about the technology and the artificial intelligence is one of the things which is being talked more about AI, how AI is going to make an impact and outcome for nursing. There's a big debate is going on. How much nurses are going to be replaced, all that discussions are going on. But you can see here, nurses will not be replaced. This is going to be used for the nursing judgment and for compassion. Whatever the artificial intelligence, it is not going to replace nurses, but it is going to help us to have a good nursing judgment and compassion. And this power of voice from power to policy. I think this is all we are going to talk these things in these years to come for the celebration of this International Nurses Day. Thank you. Sorry, I have taken time.
Thank you very much, sir, for that insightful and informative session. I request all the dignitaries to leave for the lunch, and also the students to go to the hostel for lunch. Thank you one and all for your active participation.